Welcome doctors. And let's start today's topic.
Today we will discuss the step-by-step management and treatment of diabetes. To begin, a few tests are required to diagnose diabetes. Random blood glucose test, if greater than or equal to 200 milligrams per deciliter in the presence of diabetes symptoms such as frequent urination with increased thirst and decreased appetite. Delayed wound healing will label the patient as diabetic. Or, if the fasting blood glucose test is greater than or equal to 125 milligrams per deciliter on at least 2 different occasions, or HbA1c is greater than or equal to 6.5%, the patient is classified as diabetic. Once a patient has been identified as having diabetes mellitus, you start treatment with lifestyle modification, which is always first-line treatment for diabetes. Ask the patient to do exercise every day. Change their diet to lower down their sugar intake and to lose weight. Regularize timing and quantity of meals. Don't be in starvation long. Avoid alcohol. And follow up after 3 months and check again HbA1c. If it's between 6.5 to 7, then continue with first line, and if it is more than 7, then go to second line treatment. Start a drug Medform. It acts on liver and it inhibits hepatic gluconeogenesis. It inhibits synthesis of glucose. Be cautious with renal impaired patients because this drug is excreted by kidneys and will cause lactic acidosis. Major side effect of this drug is diarrhea, which is self-limiting most of the time. In 3 months follow-up, if it is not controlled, we can add a second drug with metformin, which can be sulfonylurea, or it can be any other hypoglycemic drugs or other anti-diabetic drugs. And this is third-line treatment. After that you can start triple therapy, which is a combination of 3 types of anti-diabetic drugs together. Metformin plus sulfonylurea plus any other hypoglycemic drugs. And the last option, then we can give insulin to patients if it is not controlled, and that is fourth-line treatment. In practical approach, we can simply understand this with the 5-stage to drug approach treatment of diabetes. As age advances, beta cell function decreases, and requirement of anti-diabetic drugs, initially insulin, later goes on increasing. The drug treatment moves through 5 stages. Stage 0, if PP is 160 to 200 mg%, then diet exercise. Stage 1, start metformin. Stage 2, add sulfonylurea. Stage 3, add third newer drug. If in spite of optimum or maximum dose of 3 drugs, PP remains 200 mg% and HbA1c 7%, then it is time to start insulin. Stage 4, add long-acting insulin. Single dose in J mixtured 30:70. When dose exceeds 30 units/day, divide in 2 doses, 2/3 1/3. Stage 5, add short-acting insulin, i.e. bolus, before meal.
If you liked video, please subscribe, like, share with others. Thank you. Caffeinated Doctor signing off till next video.